no sperm. Can you comment a little bit about azoospermia and also azoospermia as people age? What happens with aging there?
Yeah, so interesting. If you look at studies that analyze the trends of concentration, motility, morphology, they actually show very stable rates across the lifespan of a male. So one wouldn't expect, like women, where their
Where they run out of
oocytes,
eggs. Yes, yes, yes.
exactly. That luckily men's sperm have almost immortality, or they should have immortality. Well, you can see a little bit of a drop off in the motility. You can see a small drop off in the concentration, but it would be unusual for
Age.
azoospermia or absent sperm to develop just as a function of aging. One thing that a lot of men pick up what are called comorbid conditions, where they
Exactly.
develop
High
new
blood pressure. Yes.
diagnoses, blood pressure meds, low testosterone. But one of the most common things that we see affecting people of all ages, and I know on the OBGYN side, you're likely seeing this too, is called pelvic floor dysfunction.
Right. Yes.
But pelvic floor dysfunction, when it kicks in, it can kick in, and for kids, it can kick in for 20-year-olds, 30-year-olds, 60-year-olds. And when those tight pelvic floor muscles that spasm in pelvic floor dysfunction, when they spasm, they block the return of blood from the testicles back up towards the heart. So if that blood gets blocked, it pools in the scrotum and it causes what are called varicose veins.
Right.
And those dilated veins can put additional stress on the sperm. So in addition to all the life stressors that a
Going
man
on.
would go through with all health conditions and chemical toxin exposure on top of it, you get a higher likelihood of what are called varicocele veins or varicose veins in the scrotum. And that is one of the more common causes of the sperm to diminish in number.
Right. 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 So, in fact, some people have said, it's been said that your semen analysis could be a vital sign,
I
right?
agree
It's
with that
cluing you in.
1,000%.
Something is going on. It doesn't maybe have to do with sperm, but something is going on with the whole body, the organism, and it's showing up in the semen analysis, correct?
Couldn't agree more.
Yeah. So if semen analysis is off, then we need to go hunting to see what's wrong with this gentleman. What else is a comorbid thing going on? Is he out of control? Does he have that out of control diabetes, high blood pressure? What else could be going on that's causing this?
Absolutely. Testosterone levels, fertility levels, all these are indicators of the likelihood of other health conditions to be present, malignancies to be present. So there's a colleague and friend of mine, Dr. Michael Eisenberg from Stanford, who's looked at the correlation between the severity of a semen analysis and the likelihood that one would be diagnosed with a type of cancer, whether it's testicular or blood. So they have a higher likelihood of developing a malignancy the more severe their male factor infertility is.
So out of curiosity, for gentlemen who are thinking one day they might want to have offsprings, should at least get a semen analysis done, correct?
Absolutely. I'm a little aggressive in the sense that I'm of the mindset that and I think a lot of people would disagree with this, but I think that healthy 20-year-olds should get a semen analysis and they should even consider freezing some sperm just to have in the bank because who knows what can happen over the course of one's life. And at 20 years of age, that sperm will likely never be healthier than it is at that age.
You just hit on something that I touched on this. I did a podcast episode on this with Seattle Sperm Bank a few months ago, and I mentioned that. And I said, gentlemen, just as we're telling women to freeze their eggs, perhaps you need to freeze your sperm. But I don't think there's enough of a clarion call. I don't think people are hearing that.
Yeah, that actually led me to become an advisor of a company called Daddy, which was acquired by Roe. I reached out to the CEO of Daddy, DADI, several years ago, and I said, is there any interest in developing a program to outreach to colleges, to students at various levels, and to be able to get that message out there that
Hmm?
you have an opportunity to get your sperm at the healthiest
Yes,
level, and while you may not use that frozen sperm,
it's
but
there.
a lot of people who get that sperm at least have that peace of mind knowing that they have healthy sperm that may not pass on as many mutations. And to put it in perspective, for every year that a man is alive, he will pass on 2 new mutations to his offspring. Whereas for every year that a female is alive, it's only half of a mutation. So it's
Incredible.
4 times more mutations per year of life that get transmitted to the offspring. And that just keeps increasing over time.